Good afternoon. Medicaid, Medicare, and the Affordable Care Act matter. Your presence today, I see hundreds here. I understand hundreds have been in the parking lot. You demonstrate how important these programs are to Rhode Islanders. We've heard a lot of statistics this afternoon. One statistic I did not hear yet is that, did you know that almost half of Rhode Island residents participate in either Medicare or Medicaid? I think it's something like 45%. So these programs are really family issues. All of us know someone in our family who is on one of these programs who would be devastated if they were taken away from us. Over 50 years ago, with the support of prior congressional champions from Rhode Island, and I'm talking about people like Pastore and Pell. These programs were enacted. Everyone knows that seniors love Medicare. It is an amazing program. Before Medicare was enacted, half of our older population in this country had no health insurance. Think of that. Today in Rhode Island, we have almost universal coverage through Medicare. Through Medicaid, we have something like 250,000 Rhode Islanders getting access to wonderful health care. We have in Medicare 203,000 Rhode Islanders on Medicare. 30,000 of them are younger disabled persons. 30,000 of them are people who have both Medicare and Medicaid because they are relying, many of them, on Medicaid for their long-term care services, for the nursing home care, for the home and community-based care that they receive under Medicaid. And I'm talking about people like John, who is an older person who is participating in our new integrated care program that is a result of the Affordable Care Act. And because of that program, John has now recovered his independence, is self-managing his chronic diseases, and getting out in the world. I'm talking about 95-year-old Aura, a frail older person who, because of Medicaid, has stayed out of a nursing home for many years because she's getting home and community-based services. These programs are absolutely vital to all of us in Rhode Island to keep them safe. If we go to voucher programs, and that has been talked about by some of the new people who are leading Congress, it will be absolutely devastating. One thing I want to leave you with is, not only for the here and now, but Rhode Island is a very old state. Some of you may know that I think we rank number 9 in percent of people 65 and older. We rank number 1 in percent of people 85 and older. I think that might be a tribute to how well we're doing. But you may not know that in the next 10 years, one short decade, it is projected that we will have 100,000 more people in Rhode Island aged 65 and older. Imagine what would happen if we go to a Medicare voucher program. The promise to these people who have contributed to those taxes all these years will not be kept. They will face the future, and they will not enjoy the kind of Medicare program that I enjoy and many in my family enjoy. So I'm delighted to stand with you today, with all of our congressional delegation and elected leaders in solidarity as we work to protect and preserve these programs. And it gives me the greatest honor to turn the microphone over to a woman who works hourly, day and night on behalf of Rhode Islanders, fighting for us, Governor Gina Raimondo.